Very good morning, everybody. Today we will be dealing with a very important topic, that is arches of foot. Full question आता है आपको arches of foot पे, ठीक है? Now, when we look at a human foot performs two basic functions. एक काम होता है body weight को support करना, दूसरा काम होता है एक lever की तरह act करना, and it propels the body forward in walking and in running. ठीक है? Both the functions are effectively carried out because the skeleton of the foot is composed of small bones. अगर small bones की जगह सिर्फ एक single bone होती तो body weight sustain हो जाता और एक rigid lever रहता आगे propel करने के लिए। मगर जो problem हो जाती वो क्या होती कि foot would not be able to adapt itself to move on an uneven surface. Okay, so उस वजह से क्या होता है, such hazards are avoided by the composition of the foot with a series of small bones which make the foot a segmented lever with multiple joints. The foot is thus more pliable and can adapt itself to uneven surfaces. So basically human foot के दो functions हैं, दोनों functions के लिए multiple bones होना और छोटी-छोटी bones होना help करती है. We have, if you look at the skeleton of the foot, we see that it is arched. We have a longitudinal arches भी हैं और transverse arch भी है. We have two longitudinal arches. We have medial longitudinal arch and we have lateral longitudinal arch. Whereas we have transverse arches, anterior and posterior transverse arches as well. Okay. Now, what are the functions of arches of foot? अगर foot arched है तो उसकी importance क्या है? सबसे पहले important चीज है, that is the distribution of body weight. If a person is about 120 pounds, तो main transmission जो मैंने first class में भी बोला था, 60 pounds जो होता है वो each foot में जाता है. फिर weight is distributed equally through the posterior and the interior part of the foot. 30 pounds will pass through the calcaneum in the posterior part और बाकी 30% जो होता है, 30 pounds जो रहेगा वो head of 5 metatarsal bone से जाएगा. Therefore 6 distribution points हमारे आ जाएंगे. ठीक है? So basically first important function is that it helps in proportional distribution of body weight. Then it helps the body in propulsive movement mechanism. ठीक है? Movement, आगे move करने में help करता है. So arch foot जो होता है, it acts as a segmented level which helps in propulsive mechanism of soleus and gastrocnemius और body को आगे move करने में help करता है. ठीक है? इसके बाद हम लोगों ने sole of foot में देखी plantar nerves, ठीक है, medial और lateral plantar nerves, क्योंकि plantar concavity जो होती है of the arches, ये protect करती है plantar vessels और plantar nerves को from compression. ठीक? अब एक कंडीशन होता है जिसको हम लोग फ्लैट फुट कहते हैं, उसमें ये आर्च खत्म हो जाती है. ठीक, उसकी वजह से क्या हो जाता है, हम लोगों के पास कंप्रेशन ऑफ नर्व्स होती है जिसको हम लोग मेटाटार्साल्जिया कहते हैं. इज इट क्लियर? ओके. देन arched foot is dynamic and pliable. That is, what does it mean? It means that जब हम लोग foot ground पे रखेंगे, when the foot is on the ground, the arch is flattened somewhat. पूरा नहीं, थोड़ा बहुत. मगर when it is off the ground, they regain their original contour. Foot thus acts as a springboard which helps jolting and jumping from a height. ठीक? Then, inverters and everters of foot produce a shift of weight distribution among the head of metatarsal bones. And it helps to adapt the foot while moving on an uneven surface. So basically, अभी के लिए आप लोग इतना याद रखेंगे कि main काम arches का क्या है, एक proportional body weight distribute करना, एक हमारे पास propulsive movements को कर पाना, protect करना underlying nerves को, एक हमारे पास help करना आगे move करने के लिए और distribution of body weight करना. Now, when we look at the arches of foot, I told you we have two types of arches. We have longitudinal arches and we have transverse arches. Longitudinal arches, we have two arches, medial longitudinal जो medial side से होगी, lateral longitudinal arch जो lateral side से होगी. जो transverse arches होंगी, एक anterior arch होती है और एक posterior arch होती है. Anterior arch complete होती है और posterior arch होती है वो incomplete होती है. So this is a diagram showing lateral view में आप देखो, so we have a medial arch and we have a lateral arch. और transverse arch ऐसे होगी, यानी if you cut it here और front से देखो, so this is the transverse arch. ठीक, ओके. अब एक सीधी सी बात है, कोई भी आर्च अगर होती है, ठीक है, अगर हम लोग कोई भी, जैसे ये एक आर्च, इस आर्च की बात करेंगे या इस आर्च की बात करेंगे, हर एक आर्च की, एक गोलाई की एक इंटीरियर पॉइंट होता है, एक पोस्टीरियर पॉइंट होता है, यानी दो पिलर्स होते हैं, एक सबमिट होगा, सबसे हाईएस्ट पॉइंट होगा, ठीक है, और कुछ जॉइंट्स होंगे जो उसको बनाएंगे. यानी अगर आप एक ब्रिज भी देखते हो, एक आर्च्ड ब्रिज भी देखते हो, तो उसके दो पिलर्स होते हैं, ठीक, उसमें कॉन्कैविटी होती है, जिसमें एक हाईएस्ट पॉइंट होता है, एक की पॉइंट होगा, ठीक, और जॉइंट्स प्रेजेंट होंगे. ठीक, नाउ व्हेन वी टॉक अबाउट द मीडियल लॉन्गिट्यूडिनल आर्च, द मीडियल लॉन्गिट्यूडिनल आर्च कहाँ पे प्रेजेंट होगा, मीडियल साइड से प्रेजेंट होगी हमारी. ठीक है, अब इसको कैसे याद करना है, ये बहुत इजी टॉपिक है, इंपॉर्टेंट और बहुत इजी टॉपिक. इट इज इजी टू रिमेंबर इट. जब हम देखते हैं व्हाट आर द बोन्स दैट आर टेकिंग पार्ट इन द फॉर्मेशन ऑफ दिस आर्च, ये आर्च, ठीक है, आर्च किससे बनती है, फ्रॉम बैकवर्ड्स फॉरवर्ड जाओ, वी हैव द कैल्किनियम, वी हैव द talus, we have the navicular, we have the median cuneiform, and we have तीनों cuneiforms होंगी, and we have the medial 3 metatarsals. Basically ये, ठीक, ये हम ऊपर से आर्च को देख रहे हैं. सो कैल्किनियम का पार्ट, टैलस, नाविक्यूलर, 3 क्यूनिफॉर्म, 3 मेटाटार्सल्स से बनती है हमारी मीडियल लॉन्गिट्यूडिनल आर्च. ओके, नाउ द पिलर्स. पिलर्स क्या, ये वाला पार्ट और ये वाला पार्ट. सो द पिलर्स किससे बनते हैं, मीडियल हाफ ऑफ कैल्किनियम, क्योंकि कैल्किनियम लेटरल लॉन्गिट्यूडिनल आर्च भी बनाती है. सो द पिलर्स विल बी फॉर्म्ड बाय द मीडियल हाफ ऑफ द कैल्किनियम. The posterior the posterior pillar is formed by the medial half of the calcaneum, whereas the anterior half is formed by the head of the 3 metatarsals, medial 3 metatarsals. The summit, that is the highest point to arch hoga, that is formed by this bone, that is the talus. So talus is the key bone of this arch. When we talk about the joints here, कौन-कौन से joints हम लोगों को main joints हैं, there is a subtalar joint that is important है, and we have a talocalcanean navicular joint. Talocalcaneum, talus, calcaneum और navicular के बीच में joint होता है, जो हम लोगों ने देखा था foot में. So talocalcanean navicular joint as an important joint of this arch. ठीक है, so दोबारा जो medial arch है वो medial side से present होगी. कौन-कौन बनाता है इसको, ठीक है, एक calcaneum, talus, navicular, cuneiform 3 और medial 3 metatarsal. ठीक, जब हम लोग आर्च देखते हैं, इसका एक इंटीरियर पिलर होगा, एक पोस्टीरियर पिलर होगा. इंटीरियर पिलर 3 मेटाटार्सल के हेड्स, पोस्टीरियर पिलर जो होगा मीडियल हाफ ऑफ कैल्किनियम बनाएगा. आर्च का एक सबसे इंपॉर्टेंट कीस्टोन होता है, वो टैलस आ जाएगा. जॉइंट्स होते हैं, जॉइंट्स में इंपॉर्टेंट जॉइंट सबटैलर जॉइंट होगा और टैलोकैल्किनियम नाविकुलर जॉइंट होगा. ठीक, अच्छा, now so the most important part, the most vulnerable part of the medial arch is the head of the talus. ठीक, अब जब यहाँ आप लोग देखते हो, अगर lateral arch के मुकाबले में देखेंगे, तो medial arch is made from more bones and more joints are present here. So resilience is a characteristic of medial arch. What is resilience? Resilience is a physical property of a material that it can return to its original shape or position after deformation. ठीक है, so resilience is the main characteristic of the medial arch. Now, talking about the lateral arch. When we look at the lateral arch is also formed by some bones. What are these bones that form the lateral arch? We have the calcaneum, we have the cuboid, we have the 2 metatarsals here, the lateral 2 metatarsals here. As compared to the medial arch, the lateral arch is low-lying and ये लो लाइंग है, ज्यादा टच करती है ग्राउंड को, तो उसका मेन काम क्या होता है, बॉडी वेट को सपोर्ट करना, ठीक है। पिलर्स किससे बनेंगे, इससे बनेगा और इससे पिलर बनेगा। सो द पिलर्स विल बी फॉर्म्ड फ्रॉम द लेटरल tubercle of the calcaneum, and anterior pillar is formed by the head of the lateral two metatarsal bones. Is it clear? Then we talk about the summit here. अब यहाँ पे जो summit highest point इस arch का रहता है, इस arch का highest point is the facet on the superior surface of the calcaneum. That is at the level of the subtalar joint. What are the important joints you see here? We have the calcaneocuboidal joint, calcaneum और cuboid के बीच में जो joint है, that is the most important joint here. The most vulnerable part of the arch is formed by the calcaneocuboid joint. Up, since less number of bones and joints take part in the formation of lateral arch, rigidity is the characteristic of this arch. ये मैंने बोला कि क्योंकि लो लाइंग है, लेस मोबाइल है, रिजिड है, इसका मेन काम क्या होगा, बॉडी वेट संभालना. Now, then we have some factors that maintain the arches. What are the different factors that maintain the arches? If you look at a stone bridge, उसमें कोई भी आप ब्रिज देखते हैं तो बनता कैसे, ठीक है, कोई भी आर्च चीज है आपने देखा, there are few things that take part here. We have number of stones here, so that means the shape of the stones matter, the size of the stones matter. The stones are joined together by small intersegmental ties. Therefore, कोई अगर हमारे फुट में आर्च है उसमें भी डिफरेंट बोन्स हैं, वो बोन्स आपस में कुछ इंटरसेगमेंटल टाइज से जुड़ी होनी चाहिए, ठीक. Then the anterior and the posterior pillars are kept at a distance from each other by tie beams. Similarly, फुट में भी देखा जाता है. And we have important thing that is sling, जो इस आर्च को, स्टोन ब्रिज को लटकाए रखती है, ठीक है, और उसको सपोर्ट करती है. सो इन्हीं फैक्टर्स के अंदर, इन्हीं टॉपिक्स के अंदर हम देखेंगे व्हाट आर द डिफरेंट फैक्टर्स दैट मेंटेन द डिफरेंट आर्चेस. नाउ सबसे पहले लेट्स टॉक अबाउट द medial longitudinal arch. What are the different factors that keep the longitudinal arch in position? सबसे पहले we have the shape of the bone. When we look at the shape of the bones here, for efficient arch support, the bones are wedge shaped. They are wedge shaped, and the thinner edge is directed in the plantar aspect. ठीक है, broader aspect ऊपर है, thinner aspect नीचे की तरफ है, ठीक. The head of the talus is the center of the arch and acts as a keystone, which is received in front by the navicular and rests below on the sustentaculum tali. So ये बोलता है कि हमने पहले ही बोला कि की बोन median arch में talus है, इसका head जो है that is supported in front by the navicular bone and by the sustentaculum tali. So shape of the bones matter. So in the medial longitudinal arch, the shape of the bones is wedge shape. ऊपर broader aspect है, plantar aspect है, ये narrow है. Then we have intersegmental ties. Intersegmental ties क्या बोलो मैंने बोला ये जो small stones को एक साथ जोड़ के रखते हैं. Same way, the different bones are connected to each other by small ligaments, which act as intersegmental ties. Okay. Now, the intersegmental ties, if you look at it, the plantar ligaments bind the lower end of bones like metal stickers. सबसे important कौन सा है हमारे पास? That is the plantar calcaneonavicular ligament, the most important. The plantar calcaneonavicular ligament is also known as the spring ligament, and as you can see here, the plantar calcaneonavicular ligament here, this supports the head of the talus. Then we have interosseous ligaments that connect the adjacent bones, and we have interosseous talocalcaneal ligaments connect same interosseous ligaments that connect these different bones. So basically, main important bone, main important जो join कर रहा है, that is this ligament, that is known as a spring ligament or the plantar calcaneonavicular ligament. Why is it important? Because it is supporting the head of this bone, that is talus, which is the key stone of this arch. Here you can see another diagram. Okay. Then we have some factors that act as tie beams. That is, they prevent the separation of the two pillars. What are these? The medial part of the plantar epineurosis and abductor hallucis, along with the flexor hallucis brevis muscle. Two muscles, mainly here, we have the plantar epineurosis and two muscles of the sole that prevent the anterior and the posterior pillar. They keep the anterior and the posterior pillar at a distance from one another. We have the plantar epineurosis and we have two muscles, that is abductor hallucis and flexor hallucis brevis. Then we have slings. What is the function of these slings? The slings suspend the arch from above. Okay. Now, the tendon of tibialis posterior, lying underneath the spring ligament, provides dynamic support to the head of talus. Here. So here you can see this is the medial longitudinal arch. So here we can see that this tendon is the tendon of tibialis posterior. The tibialis posterior sling क्या होगा जो ऊपर से इसको लटकाए रखेगा, right? So when we look at this is the spring. So the tendon of tibialis posterior muscle lying underneath the spring ligament, यहाँ पे हमारा spring ligament है, उसके नीचे से जाता है. It provides support to the head of the talus. It is also held by important muscle here, that is the flexor hallucis longus muscle, this muscle. So these two muscles, that is the tibialis posterior and the flexor hallucis longus muscle, they act as slings for the medial longitudinal arch. See, tibialis posterior क्या करता है? It supports the head by passing deep to the spring ligament. When we look at the flexor hallucis longus muscle, this muscle, the flexor hallucis longus muscle is the bulkiest and the strongest muscle of the medial longitudinal arch. अब इसके functions क्या रहते हैं? As you can see here, एक ये support इसको करता है because it passes along the talus के posterior groove जो होता है, जो मैंने बताया था आपको osteology में. So there is a groove on the posterior surface of the talus, उसके through pass होता है, तो ये talus को support करता है. उसके अलावा it passes underneath the stenticulum talli, so that means ये हमारे यहाँ पे calcaneum को support करता है, ठीक है. उसके अलावा it stretches the arch like string of a bow, ठीक. So the tibialis posterior muscle and this muscle ये slings की तरह act करते हैं. So this is a diagram that you can make in your exam. Easy diagram. सारा इसमें different bones cover हो जाती हैं, tie beams हो जाते हैं, slings हो जाते हैं, और intersegmental ties वगैरह सब हो जाते हैं. Now, what are the factors that maintain the lateral longitudinal arch? Lateral longitudinal arch, as you remember, the lateral longitudinal arch was formed by calcaneum in posterior pillar, anterior pillar by the head of the lateral two metatarsal bones. So, what are the factors that maintain the lateral longitudinal arch? सबसे पहले shape of the bones. There is a triangular projection of the bone known as the calcaneal angle of cuboid, which projects backwards from the inferior border of the proximal articular surface of cuboid and occupies the interior aspect of the surface of calcaneum. Basically, एक projection है cuboid के पीछे की तरफ जो calcaneum में fit रहती है, वो maintain करती है upward tilt of the long axis of calcaneum. Then we have intersegmental ties. The intersegmental ties here is supported by short plantar ligaments and long plantar ligaments. They act as intersegmental ties and different bones को जोड़ के रखते हैं. The short plantar ligament is broad and thick. It lies deep to this long plantar ligament and it supports the calcaneum cuboid joint from below. The long plantar ligament is long and supports the joints between the calcaneum, the cuboid, and the metatarsal bones. So ये intersegmental ties की तरह act करती हैं. Then we have the tie beams. The lateral part of the plantar epineurosis, medial part was acting for the medial longitudinal arch, the lateral part of the plantar epineuritis and the intrinsic muscles of the little toe act as tie beam for this arch. When we talk about the muscles that act as slings, which is important. So what are the muscles that act as slings here? The tendons of peroneus longus, peroneus brevis and peroneus tertius muscle, this muscle, peroneus brevis and peroneus tertius, these are inserted into the base of the fifth metatarsal. So ये weak sling की तरह act करेगा क्योंकि इसकी distance भी कम है. मगर the tendon of peroneus longus muscle, which we know, it grooves the inferior aspect. दो बार turn करता है, बता चुकी हूँ मैं class में. So it grooves the inferior aspect of the cuboid bone and then it moves transversely across the sole and is inserted into the base of the first metatarsal and the medial cuneiform. यानी ये पूरा foot को नीचे से पूरा जाके arch पूरा support करेगा. So ये जो है ये इस पे pulley like action करता है. So we have a weaker sling that is formed by the peroneus brevis and the peroneus tertius, and we have a strong muscle that acts as a strong sling or a pulley-like action to it. That is the tendon of peroneus longus, and you know that the groove on the cuboid is due to this muscle. So here you can see this is the peroneus longus जो पूरा groove करके जाता है. So ये lateral side को पूरे को support करेगा. Talking about the transverse arches, we have two types of arches. We have anterior transverse arch and we have posterior transverse arch. यहाँ पे इसने anterior transverse arch दिखाई है. जब हम लोग देखेंगे तो that is formed by the head of the metatarsal bone. It is complete. Why? Because when you stand, the head of the first and the fifth metatarsal comes in contact with the ground and it forms the two ends of the arches. Talking about the posterior arches, the posterior arch is formed by the greater part of the tarsus and the metatarsal bones. It is incomplete. Why? जब दो foot एक साथ रखते हैं तब ये पूरी arch complete हो जाती है. So that means हर पैर में incomplete posterior arch है. So here you can see anterior arch. ठीक है? Here we have removed the tarsals and the metatarsals. We are looking at the head of the metatarsals. ठीक है? इस level पे. So head of the metatarsal forms a complete arch. Here you can see. This one is a complete arch. Posteriorly, it will be an incomplete arch. Now, what are the factors that maintain the transverse arches? Same topics under hai. We have the shape of the bones, wedge-shaped nature of the three cuneiform bones, and basis of middle three metatarsal bones form the arch. Intersegmental ties किससे होगा? Plantar surface, tarsal और metatarsal के बीच में they are joined together by deep transverse ligament, intrinsic plantar ligaments, dorsal interosseous, and oblique and transverse head of adductor hallucis muscle. So you can see इनके बीच में we have deep transverse metatarsal ligament जो उनको जोड़ के रखता है, तो intersegmental tie की तरह act करता है. और हमारे पास this is the oblique and the transverse head of the adductor hallucis. It also acts as an intersegmental tie. Acting as a tie beam, we have the tendon of peroneus longus and tibialis posterior. Acting from above, the peroneus tertius and peroneus brevis on the lateral side and tibialis anterior on the medial side support the transverse arches. Tibialis anterior and posterior transverse arch को medially करेगी और peroneus longus laterally करेगी. Now, coming to some clinical conditions associated with the arches, the most common condition is flat foot. This is known as pes planus. It's the commonest foot problem. This is the normal foot. This is a flat foot. It occurs, why? Because there is a collapse of the medial longitudinal arch. It happens in long periods of standing when the plantar epineuritis and the spring ligaments are overstretched. इसकी वजह से क्या होता है? Spring ligament was supporting the head of the talus. So the support to the head of the talus is lost and it is pushed downwards between the calcaneum and the navicular bone. जिसकी वजह से क्या हो जाता है? Head of the talus is not supported. Now it falls down and the medial longitudinal arch जो होती है वो खत्म हो जाती है and there is a lateral deviation of the foot. अब इसकी वजह से क्या प्रॉब्लम्स हो जाएंगी, जो हम लोगों ने इसके फंक्शंस पढ़े थे वो ये खराब हो जाएंगे. सबसे पहले the person usually has a clumsy shuffling gait due to loss of spring action. I told you medial longitudinal arch का main काम spring action होता है foot का. Then foot is more liable to trauma and there is a compression of the nerve, the medial and the lateral plantar nerves, which leads to a neuralgic pain that is known as metatarsalgia. यहाँ पे there was flattening of the arch. There is a condition जहाँ पे there is an exaggeration of this arch. When there is an exaggeration, यानी ये बढ़ जाती है arch, ज़्यादा exaggerate हो जाती है, that is known as high arched foot. High arched foot or pes cavus. What happens? The plantar, there occurs a plantar flexion at the transverse tarsal joints. The anterior part of the foot drops below the level of the posterior part of the foot. Now, when the patient walks with high arched foot, there will be a dorsiflexion of the metatarsophalangeal joints and plantar flexion at the interphalangeal joints. है यहाँ पे interphalangeal joints को flexion करना है क्योंकि अब arch बढ़ गई है. Whereas there is a dorsiflexion at the metatarsophalangeal joints. Such deformity associated with the pes cavus is known as clubfoot. Then a very important condition is known as clubfoot or talipes. You will get a full chapter on clubfoot in orthopedics. The clubfoot can be congenital or acquired, and we have 5 types of clubfoot. What are these? We have talipes equinus. याद रखो जिस पार्ट पे वो चलता है उसके हिसाब से उसका नाम है. Talipes equinus, horse-like. In this condition, the foot is plantar flexed and person walks on toes with the heel raised. ठीक, so ये toes पे चलता है, heel is raised. This is known as talipes equinus. Then we have talipes calcaneus. Talipes calcaneus पे calcaneum पे चलता है. In this condition, the person walks on the heel and the forefoot is raised. Then we have talipes varus. In this condition, the foot is inverted and it is adducted. The person will walk on the outer border of the foot. Then we have talipes valgus. In this condition, the foot is everted and abducted. The person will walk on the inner border of the foot. Then there is a condition in which we see that is known as talipes equinus varus, that is commonest. Deformity, इसमें क्या होता है? इसमें in this condition inverted भी होता है, adducted होता है और plantar flexed भी होता है. So दो चीजें एक साथ होती हैं. That is known as talipes equino varus. Okay, so that is basically varus deformity or equinus deformity का combination. So there will be a plantar flexion and inversion and adduction. Hallux valgus. In this condition, the big toe is deviated laterally, where at the metatarsophalangeal joint. Normally देखा जाता है due to constant wearing of pointed shoes with high heels. The head of the first metatarsal bone becomes prominent and it rubs against the shoe. Because there is rubbing, तो protective mechanism की वजह से there is a bursa है and this is known as bunion. Then there is hammer toe. It is a deformity of the toe in which the metatarsophalangeal and distal interphalangeal joints are hyperextended, but the proximal interphalangeal joint is usually flexed. So there will be a flexion and hyperextension. Okay. This deformity usually occurs in second and third toe. So this finishes your arches of foot. Please prepare arches of foot as a long question and you have to write all the clinical conditions associated with it. Thank you.